The WHO says the public health risk at this point in time remains low. But the phrase human to human transmission, it has that horrific nostalgia that's attached to it. And understandably, it has alarmed people as well. How worried should the average viewer actually be? Help us understand the Andes strain and the symptoms that people aren't aware of at this point in time.
Thank you very much for having me on the show. WHO is right that though there is a risk, it is not going to be like a COVID. However, whenever any small infection comes, it always has a potential to become big. When we talk about the Andes strain,
Yeah.
it has a potential to cause respiratory syndrome. It's called Hunter respiratory syndrome. And Hunter respiratory syndrome is much more severe than the other syndrome, which is called HF hemorrhagic fever renal syndrome, that is usually caused by Hunter strain or Seoul strain or Dobrava strain. So when you are likely to get an infection, which and subsequent condition, which can be in 40% cases fatal, 40% death rate.
Wow.
Therefore, and this is very important here. Secondly, most of the infections they end up from rat or rodents to human being. After the human being to human being transmission, only Andes strain is known for that. So Andes is notorious for two things. One is giving a very severe infection or severe disease, and secondly, human to human transmission. Now, when there is a human to human transmission possible, then it will spill over out of the ship. Already, a lot of people have disembarked. This is like a city bus, which is people are embarking and disembarking. It is not a ship where they boarded at one place and they will go back to the same
So
place.
even as the WHO downplays all of that, Dr. Gilata, how dangerous is this? All those people, those who have disembarked, it takes about 42 days for it to, incubate. How dangerous is all of this in terms of, developing this new hantavirus outbreak?
So, because the incubation period is long, during this incubation period, the person can infect other people and without knowing. Sometimes they may not also know that they have come from this kind of contact. So, for example, those people who would disembark a month before, they could have been also infecting somebody. So, it can cause some infection. However, because it is not droplet infection, it is not a kind of a COVID where one person can infect hundreds of people. It is not possible here. It is the reinfection factor is much less as compared to COVID. That's the reason that it cannot become COVID, but we should be worried because of two things. Number one, there is no
Okay.
cure. Number two, there is no vaccine.
Dr. Gilada, let's talk about these floating petri dishes. This happened on a cruise ships, and cruise ships have repeatedly become centers of infectious outbreaks. What makes these floating petri dishes medically so vulnerable despite our modern protocols that are in place? And whilst you're at it, there is currently no widely approved vaccine for hantavirus, just like you mentioned in your opening submission. In outbreaks just like these one, early detection is going to become the biggest weapon now, isn't it?
See, basically, when you talk about a ship,
Yeah.
and in this situation, ship is an isolation center or isolation hospital. So there are advantages and disadvantages. One advantage is that the infection is contained in the ship, and now onwards, those who are disembarking, embarking, anybody going in and out, they will be under vigilance and they will be checked. Secondly, there is a very much simple principle in medicine. Common things are thought of commonly, rare things are thought of rarely. Currently, in ship, they will always think of hantavirus. Whereas if you talk about Mumbai, Delhi, or anywhere else, if such people come with fever, cough, etc., we'll think of dengue, we think of malaria, we think of other flu, we'll not think of hanta. So it will all depend on where the patient is. And thirdly, you are answering your previous question, giving you a very simple analogy. Anybody who becomes a doctor or engineer or professional, they come from 10 plus 2. But everybody who is 10 plus 2 doesn't become a doctor, engineer, or a professional. So that means for 10 plus 2, we need to keep on working so that we always feel that that person should go to professional course. Same thing that we think of the worst and do our best. We think that yes, worst thing can happen with hantavirus. But as a scientist, as a medical community, as a WHO,
Yeah.
what best we can do? There is no cause of concern for common man. And that's what is our request from all three of us. That currently, yes, this is a cause of concern for scientific community, for public health community, for governments, but it's no cause of concern for common man. Because currently what happens is any news comes in media, in newspapers, people start calling, we have seen rats in our home, is hantavirus in our rats. So basically when common things are there like rat or you're dusting or you're using broom and all these things are spoken of, people will consider that they're at risk.